right, so thank you for the global tallies. Here in Korea, Omicron appears to be taking over the pandemic scene, and Kim Yeon-seung joins me now with details on that. Yeon-seung, good to see you again.
Thank you for having me, Sunny.
Right, so I mentioned, Omicron is dominating our COVID-19 infections.
Yes, exactly. So experts have been projecting that reality for days now, and it seems like we finally reached that point. President Moon Jae-in said Monday that Omicron has spread rapidly to become the dominant strain in South Korea. He urged health authorities to quickly get ready for a faster response and for South Korean people to help in preventing the spread of the virus through diligent mask wearing and vaccinations, especially ahead of the upcoming Seollal holiday.
Right, Yeon-seung. And Omicron is accounting for what proportion of our daily cases so far?
Well, according to the Minister of Interior and Safety on Monday, around half of last week's cases were identified as Omicron infections. First, take a listen.
With Omicron infections spiking mainly in Gyeonggi-do province and the southwestern Honam region, Omicron cases have been identified in around 50% of the cases nationwide.
And against the backdrop of the Omicron spread, cases are rising quickly, with an average of close to 6,000 daily infections being reported last week. That's a 50% jump from the week before. And I'm sure you remember, Sunny, but I was here last Monday when the daily caseload was at around 3,800 cases. And as Hoa mentioned earlier, a week later, the nation is reporting 7,513 cases, and it's double the tally from last Monday.
Right, and how is our healthcare system, Yeon-seung, coping with this reality?
Actually, the medical sector seems to be doing fine so far. Critical cases are significantly lower compared to last month. Like Soa mentioned earlier, there were barely over 400 critical cases nationwide today compared to over 1,000 less than a month ago. Also, according to authorities, just under 20% of the country's ICU beds have been filled as of Monday. This is a sharp decline from the figures we saw throughout November and December of last year, when close to 90% of the beds were occupied.
Right, Yeon-seung, and that is good to hear, of course. But there is strong belief that Omicron will trigger an explosive surge in the number of daily infections in the near future. How are authorities here bracing for that scenario?
Well, starting from Wednesday, Wednesday of this week, health authorities are phasing into an Omicron-tailored containment strategy. One of the changes being made is shortening the isolation period for confirmed patients. If patients are fully vaccinated, they just need to self-isolate for a week instead of 10 days. Take a listen to what else this plan entails.
Rather than trying to control the size of the spread, we'll aim to minimize deaths and critical cases. We'll conduct PCR tests mainly on high-risk patients, and for low-risk people, they will be tested through rapid antigen tests at COVID testing centers.
This new system will first be trialed in regions that have seen an alarming spread of the Omicron strain, namely Gwangju, Jeollanam-do province, and the cities of Pyeongtaek and Ansong in Gyeonggi-do province. The new plan will also spread out the medical burden. Local doctors and health clinics will also be mobilized for COVID-19 testing and treatment. So specialized hospitals or frontline medical workers will no longer have to bear the exclusive burden of our pandemic response.
Right, I see. Yeon-seung, I understand changes are also taking place on this Monday regarding the country's vaccine pass system. Tell us more.
Right, Sunny. So vaccine pass waivers will be extended to people who have been hospitalized 6 weeks after they've gotten their inoculation, or people who've had adverse side effects. So before, exemptions were exclusively given to people who found a causal link between the vaccinations and the adverse reactions, but now this is no longer necessary. People just need to provide their local health clinic with their hospital records or a doctor's note documenting their post-inoculation side effects. Then they'll get a waiver on their mobile CUV or QR code apps, and they're good to go.
Right, Yeon-seung, one final question before you leave us today. The extended Lunar New Year holiday is set to begin this coming weekend. And how are authorities seeking to prevent perhaps a holiday surge?
Right, so I'm sure many people are really looking toward this much needed rest in their holidays, but unfortunately, there's going to be people who aren't going to be able to rest, and those are frontline medical workers in the capital city. The Seoul city government on Sunday said that they're going to keep the doors open for testing centers, infectious diseases hospitals, and residential treatment centers throughout all of the holidays. There are also going to be a hotline in place for emergency patients. Seoul's public transportation network will also run on an extended schedule to prevent overcrowding on buses and trains. The Minister of Interior and Safety also said temporary COVID-19 testing centers will be set up at highways and rest stops, train stations, and bus terminals so that people can easily get tested and travel across the country.
Right, that is good to know. All right, Yeon-seung, thank you for the latest here on the local front.